name is Moyolua.
I can be named delivery from Orinta.
My name is Eritan Oshimila Rachel.
Like.
Mrs. Onolola Adibite.
Moyolua Shewa. I'm a 400 level medicine student of Olabisi Onabanjo University. I'm from Oyimsa. Epilepsy, yes I have. I've heard about epilepsy.
Yes, I am.
Yes, I am.
Yes, I am. Epilepsy is called warapa in Yoruba language.
Epilepsy in my language is akukunado.
It's called vivaed. Growing up, I thought epilepsy was a spiritual attack. Like, I wonder why you just fall down on the floor and like start shaking. What can I cause it? But I think now I know better.
Actually, epilepsy is something. Let's just say it's a disease.
So warapa yẹn àwọn burúkú ló kọ́ méjì kò ṣe wá.
Warapa jẹ́ nǹkan tó jẹ́ pé ó máa ń ṣe èèyàn kò ní iye ọjọ́ kò ní iye ọmọ ọdún pé set ọmọ ọdún báyìí ló ń ṣe set ẹnìkan báyìí ló ń ṣe.
Ìdàkejì dẹ̀ rèé ó tún jẹ́ àrùn tó tún máa ń ṣe ẹlòmíì nínú ìdílé wọn. Àrùn tá à sì ń sọ̀rọ̀ yìí kò ní ìtìjú.
Like gbígbọ̀n yẹn máa wà rampant gan tó jẹ́ pé to be foaming out some things like white saliva in the mouth.
Ó fún gan bí tó bá ti ń dá pìtìpìtì gan ó lè pè sínú náà.
Genetic disorder that causes, or rather the symptoms is like the person has seizures.
What I know about epilepsy, it's a neurological disorder. Usually when there are issues with every portion in the brain that lead to seizures and
It's a disorder that's, I don't know, it's come from the brain or something, and one of the effects or one of the signs or symptoms is I don't know, foaming and the rest. Yeah.
Epilepsy is a mental illness, it's a mental disorder that happens due to disturbances in brain waves, basically.
Yeah, and since someone is manifesting and puts a spoon in the person's mouth and it's stuck, yes, I think that they mean, I don't think it's true.
Whenever there is a spiritual attacks, it will cause like that, and to some they believe that it do happens to some family like that.
Epilepsy, like the other things, the myth that I've heard about epilepsy is that when you see somebody going through an episode of involuntary movements on the floor, don't go near the person, because once the speech touches you, you basically have what the person has at least.
When people that have epilepsy are, they have stiffness and stuff like that, and then I've heard people say that it's communicable, right? That you should not go near someone that has epilepsy, or you should try to avoid them because they have, what they call it, epilepsy.
I think the second thing I've heard about epilepsy is that when you see a wall gecko, don't go near it, don't kill it, because once the spit touches you, you have epilepsy.
It's mostly triggered by noise, and when they're experiencing that seizure, you have to like use something to prevent them from closing their mouths, like maybe a spoon or a mental thing, or probably use your hand to block them from closing their mouths so they won't bite their tongue and die.
You see it in Yoruba movies.
Kò kí n sáwọn ọpọlọ o. Kò kí n sáwọn ọpọlọ rárá. Àwọn ọpọlọ yàtọ̀.
I don't really believe so. Actually, I don't really believe so, because actually it happens to some family like that. Tí bàbá bá ní, they will believe that àìsàn tó ń ṣe wọ́n ní family wọn like that. They believe to some family it's a cause. Nǹkan tó ń ṣe wọ́n family wọn pé nǹkan tó ń ṣe bàbá ẹ̀ nìyẹn ó dẹ̀ ti ń ṣe ọmọ náà. So they believe it happens like that to some family. Bí àwọn ogun ìdílé like Yoruba do say.
Yes, it is, but not mental illness in the way everybody uses mental illness, because it's a brain disorder, and it just varies. Some people just go through it just once. Some don't even go through any episode except it is provoked, maybe light and some people actually go through it like 7 times in a day. So it just depends on the severity of the disorder. Either it is genetic, or it is metabolic, or it is immunologic, whichever it is that is causing this disturbance in brain signals.
Well, you could call it one since it's a neurological illness. I mean, since it affects nerve impulses in the brain and leads to seizures, you could say it's kind of mental, but yeah, I would say it is basically.
Probably.
No, I don't.
Ní believe Yorùbá nílẹ̀ Yorùbá tá wà yìí and pẹ̀lú àwọn ìrírí téèyàn ti rí, I would like to say it is communicable.
àkọ́kọ́ náà ní tí wárápá bá ń ṣe èèyàn ò lè fi abọ́ ẹ̀ pléètì ẹ̀ àbí spoon èèyàn ò lè fi jẹun.
There's one particular stuff coming out from those people that experience epilepsy, and I think that thing should be communicable.
ẹni tí wárápá bá ń ṣe èèyàn gbọ́dọ̀ wá ṣọ́ra fún un torí pé ó máa ń ràn á máa rò tó lẹ́nu bá ti ń dà pìtìpìtì àwọn àrò tó lẹ́nu. So ìtọ́ yẹn ò gbọ́dọ̀ kan èèyàn ò gbọ́dọ̀ kẹlòmíì ní ara tó bá ti kẹlòmíì lára ẹlòmíì náà ó máa ní.
I don't know enough about it to know if it's communicable, but I don't think so.
No, epilepsy is not a communicable disease, non-communicable disease. And the fact that you are saying besides someone who is going through that particular episode at that point in time doesn't mean, in fact, no, it doesn't mean you're going to get it. So it's a non-communicable, it's a chronic disease, but it's a non-communicable disease.
Except to know this, but in reality, no.
àti ráhùn tó ṣe tó kìí ṣe pé bí tí kìí ṣe pé bóyá pé wọ́n sọ àwọn tí ó ti ṣe tí mi ti rí.
No, I haven't, not yet.
No, I haven't.
No, personally I've not. The best that I've seen with epilepsy on TV, but personally I've not experienced anybody having it.
Yeah, I experienced one when I was in my jam class back then. It was still out in front and just happened suddenly, he fell on the floor and started shaking. We were all laughing, everybody was scared what was going on. But our teacher asked us to like move backward and started praying for him till he stood up.
ní gbogbo àgbà àwọn ò lè so mọ́ o àwọn ò lè so mọ́ so àti ẹ̀ ti rí dáadáa bẹ̀tì ẹ̀fọ́ nǹkan náà lé wọn gan a kì í fẹ́ lọ síbẹ̀ torí àti àbílífù pé táwọn bá tán lọ sínú ilé wọn gan láti bẹ̀ ẹ̀rù ẹ̀ tó lè kó.
Yeah, like so many times. So back then in school, my experience with some colleagues in school from my department, because I happen to be a comrade, an activist fighting for the interest of the people. And if anything or any lapses should happen on campus, I will be called. So, and I experienced much of it while in school. Because we just used to call the attention of the medical practitioners and then they will take care of the person. Time the person is in the process, like that grief, like that shock is happening, you don't have to move closer to the person. All what you have to do is just pour the person water, use water to sprinkle the water on the person and then move aside. Don't know if medical like drugs or anything can cure it. I don't know. But what I believe most Yoruba believes in that anytime it happens to people like that, they will tell you, even to some doctors will even advise you to even treat it spiritually. So that's what I say.
I don't know. The best thing to do would be to call like a medical person, the ambulance or something of the sort.
That's whoever I think is will be able to handle the situation, because I don't think I'll be able to handle that situation at that particular time. So yeah.
If I was to experience one, what would I do? Okay, I think first of all, I mean, they always teach us that in an emergency, you just have to make sure that the person is breathing properly, right? So if the person is breathing properly,
But try to get the person not to cause injury to his or herself.
stabilize the person for a bit. And then, as opposed to what people would think that you should try to by force put something in their mouth, that is kind of, I don't know, you can end up either injuring their teeth or injuring yourself by getting yourself beaten. So it's just better to just keep their airways open and help them stabilize till they get better while you call for help if need. What I would do.
I think the first thing that I would do would be to clear the environment of anything that can cause physical injury. So like wood, glass, chair, table to just free the space so the person will not inflict any harm on him or herself. Then I think I'll just rest the person on the lateral side, like on the side. I'll rest the person on the side till the episode is over, and obviously advise the person to see a doctor so the doctor can prescribe the adequate drug, because the frequency of the episode usually differ. Some people have it like once in a year, some have it several times in a day, some it's provocative, so something triggers it. So I'll just advise the person to see a doctor so the doctor can prescribe a drug and the person can stay on for years so it is controlled.